Hi, my name is Hannah. I'm here to show you how to perform CPR today. So the main reason why we would be doing CPR is for a patient who is in cardiac or respiratory arrest. So the first thing that I'm going to do is I'm going to alert the veterinarian and the other technicians that I have an emergency situation going on and it requires some help. The next thing that I'm going to do is I'm going to evaluate the patient by physical exam. So I will be taking the femoral heart rate, by physical exam. So I'm going to be looking at to see if my patient is bleeding out of its orifices, such as nose, eyes, or ears. And I'm going to be looking if my patient is bloated for signs of GDV. I'm going to be looking if my patient is conscious. And I'm going to be looking if my patient is seizing or having respiratory distress. So I'm going to be then doing my vitals and reflexes. So the vitals I'll be taking at the femoral vein, or I could take it at the heart. And then I would be doing respiratory at the lungs and getting my compression, my rate there. I will then be checking my mucous membranes, as this gives me a good indication on if the circulation is working well or if there is shock happening, and shock could indicate brick red mucous membranes as a maldistribution. So then I will be looking at my reflexes. So the main reflex I'm going to look at is my pupillary light reflex. So I will be taking a flashlight or the pen light that I have, and I'll be shining it at the dog or cat's eye and seeing if the pupil constricts. If it constricts, that's good. That means that the nerves are still working and sending signals to the brain, but if it does not constrict, then it probably has brain damage and CPR might not be necessary. So after all this, I'm going to attach some monitors to my patient, mainly an EKG and a capnograph. So after all of that, the capnograph is for the ventilation and my EKG is for circulation. After all of that, I can start by doing my basic life support. So my acronym for that is CAB. So with that is circulation and compressions, it's airway and it's breathing. So I can start off with circulation and compressions. So to start, I'm going to flip my patient into right lateral recumbency. And if my patient happened to be a deep-chested dog or a larger dog, I can leave it in sternal or lay it in lateral. I can leave it in lateral or turn it into sternal for both. And if my patient was a small dog, I would just leave it in lateral recumbency. So there's different types of compressions, which is my next step, which is compressions. For large dogs over 25 kilograms, I can do abdominal compressions. I would take my hand over hand and start doing the compressions on the stomach. If my dog was a medium-sized dog like this one, I can do thoracic compressions and just do it right over the heart and do the same way. If it was a small dog or a cat, I would take my hand and thumb, place it over the chest, over the heart, and squeeze it that way. I could also do internal compressions if I was absolutely desperate. So I can, the compressions should be 100 to between 100 and 120 for 2 minutes, and I can do that for 20 minutes, but they should be between 100 and 120 for 2 minutes, so that's basically 2 compressions per second. So as I said before, I will do these compressions for 2 minutes, and I can show you how to perform them with the thoracic. So hand over hand, and I have my timer, and all the weight will be coming from my hips versus my elbows. This is incorrect, and this is correct. I will make sure my patient is nice and close to me, and I will start. That was 2-minute compressions. Going over my notes and clinical principles for 14. In my notes it says not to stop to do breaths, but you could if you, so I would do this completely for 2 minutes, as my patient should be hooked up to an oxygen, although you could do 30 compressions to 2 breaths if you wanted to, so it'd be 30 compressions, 2 breaths, back to 30, back to 2 for 20 minutes. So after I'm going to perform the compressions, I could do a precardial blow where I would take the palm of my hand and hit the heart nice and hard, but I should only do this for a few times as it could cause damage to the heart. So after that, I'm going to take my patient and lower the head, keep the head lower than the rest of the body, making sure that the blood flow goes back to the brain. And after all of that, I can do a thoracotomy if I wanted to get to the heart even further for internal compressions. So after that, I'm going to go to A, which is my airway. So I'm going to ensure that my patient has an airway, and I'm going to either intubate or, if I need to, re-intubate, and make sure all my vaporizers is turned off as the flow meter bypasses through the vaporizer, which could keep my patient under the anesthetic, and nobody wants that. So my next step is for breathing, and so for the breathing, it has to be 10 breaths per minute, so that's basically 6 breaths. 1 breath per 6 seconds, be a lot of breaths. So 1 breath per 6 seconds to get to 10. And I can do mouth to endotracheal tube, and I would blow in and see my chest rise. Or I could do manual assisted ventilations with my MBU bag, just hook it up and squeeze it. Or I could do my, I can turn on my oxygen, and then I can do my ventilator and tidal volume. The tidal volume should be between 10 to 20 milliliters per kg for the dogs. And then I can do my rate of inspiratory time and ratio, and then I can, so the ratio should be 2 to 1, 1 to 2. It should be 1 to 2 ratio. It should be a 1 to 2 ratio, and I can demonstrate on how to do the breaths as well in a few moments. And so I should be sure that when I'm breathing in, I should make sure that the chest is risen and that my timing is correct. And I can start my breaths. I'll show you 10 for a minute within 6 seconds. And I'm making sure that my patient's still on the table. Making sure that my chest is rising and that there's no obstructions. There's 6. And that was for a full minute. So after that, I'm gonna be sure that that my manometer is between 20 for the dogs and 15 for cats, and I'm gonna be sure that my CO2 buildup is not building up in the soda lime, which isn't good. If all of this fails, I can move to advanced life support, which is defibrillation and drugs. So for defibrillation, I'm going to attach my EKG and just make sure that it's either atrial or ventricular fibrillation, because that's the only way that I can fix it with the defibrillator. And then I can use the lowest joules. I can attach my pads, and I can be sure not to use alcohol. So the joule percentage is, or the joule amount is 2 to 4 kilojoules per kilogram. And like I said, you're going to start off with the smallest amount and work your way up. And you can attach the pads to the chest. Make sure not using alcohol, as that could start a fire. And you're going to use your lubrication. You're going to prep yell clear. Make sure you're not on a metal table, and just clear your patient and shock them. And then afterward, I can also do drugs, which is I can start an IV. If I don't have IV, I can go IO. If I can't go IO, I'm going to go IT. And if I can't go IT, then I'm going to go IC. So after that, I'm going to start an emergency. I'm going to grab my emergency kit. I'm going to obtain orders, and I can then proceed to prepare and administer medication. The aim for this is to to get proper tissue perfusion. So for the drugs, I'm going to, my acronym is Help Save Dog and Cat Lives. So the HELP is heparin. It's an anticoagulant, and it is used for thrombosis and DICs. It should not be used in patients with blood disorders or blood diseases. And it can go IV, IC, IO, or sublingual. You can also, and then my next one is sodium bicarbonate. It is an alkalizing buffer, and it is used, it can go IV, IC, IO, or sublingual, and it's used for metabolic alkalosis or hyperkalemia. And my next drug is Salix or Lasix, and it is a loop diuretic, and it can go IV, IC, IO, or sublingual, and it is used for diuretic. You should be cautious because it can cause hyperkalemia, but it's used for renal and acute heart failure. But it can also be used in udder edema or epistasis in racehorses. Help save, and then A is my atropine. It's anticholinergic, and it is can go IV, IC, IO, or IT because it is part of naval. It can also go as sublingual. And naval is all the drugs that can go IT, so it stands for naloxone, atropine, vasopressin, epinephrine, and lidocaine. So again, atropine is used for sinus bradycardia or AV heart block, and it can cause tachycardia, dry mouth, and constipation if you're not careful. And then my next drug is my Valium, and it is used, it's a benzodiazepine, and it can go IV or rectal, and it's used for status epilepticus, or it can also be used for a muscle relaxant in cats or any animal, an appetite stimulant in cats, and it can go, or it can muscle relaxant. And then my next drug is vasopressin, which is part of naval, so it can go IV, IC, IO, IT, or sublingual, and it's used to increase the blood pressure. It can also be used for diabetes as well. And then my next drug is epinephrine, so it's epinephrine without lidocaine, so it can be used to increase the heart rate and force of contractions, and it's a catecholamine, and it should be used 1 in 1,000 and 1 in 10,000. So then my next drug is doxapram. It's used as a muscle or a respiratory stimulant, so it's mainly used in neonates just to increase the respiratory rate. It can go IV, IC, IO, or sublingual, and it's mainly used in sublingual in neonates. I don't know if I mentioned that epinephrine is also part of naval, so it can go IV, IC, IO, IT. Sorry, back to dopamine. Dopamine is a catecholamine as well, and it's used to treat shock in instances, and it can go IV, IC, IO, and sublingual. And my next one, A is all my antagonists. So the antagonists include naloxone, which is part of naval, so it can go IV, IC, IT, IO, or sublingual, and it's used to reverse opioids. Then you have yohimbine, which can go IV, IC, IO, or sublingual, and it's used to reverse xylazine. Then you have your flamazole, which can go IV, IC, IO, or sublingual, and it is used to reverse benzodiazepines. And then you have your antipamazole, which can be used to reverse dextromethorphan, and it can go IV, IC, IO. After that, I have my CAT, which is my calcium gluconate. It's used to treat milk fever or eclampsia in dogs. And then, so it can be given IV, IC, IO, and it should be given slowly as it could cause the heart to stop. My next drug is corticosteroids, mainly dexamethasone, which is in our emergency kit at St. Clair. And it is used to treat shock or anaphylaxis shock or vaccine reactions. And it can go IV, IC, IO, or sublingual. So L is my lidocaine without epinephrine. It's part of nasal, so it can go IV, IC, IO, IT, or sublingual, and it can it's used to increase the heart rate. And then I have my my last L, which is lactated ringers, and it is used to treat hyperkalemia, and it can go IV, IC, IO. Lidocaine is also a antiarrhythmic drug, so it treats arrhythmias as well. And it can go, so lactated ringers can go IV, IC, IL, or IO and sublingual, and the rate is 40 milliliters per kg per day for dogs, and 20 milliliters per kg per hour for cats. Hour instead of days, hours. And that's it for my drugs. So some things that I can do as a technician are I can learn to assess an emergency and triage properly, and then I can also assess the patient throughout the assisted ventilations and compressions, and I can then I can also prepare and operate standard equipment such as monitors, and I can also perform a cardiac massage and respiratory assisted ventilations under standing orders, and I can also prepare and administer drugs to my patient. So the next thing I'm going to talk about is mainly the drug kit that we have at St. Clair College. All of the drugs that I listed were in there, and so some of the things that also should be in there are 2 butterfly catheters, 1 of each gauge. You should have 2 of each IV catheters. You should have 4 of each of the different needle sizes. You should have 4 3-ml syringes. You should have 2 of each of the rest of the syringes. You should also have an IV administration set, and you should have 1 10-ml syringe. You should have 1 sterile water and 1 tourniquet. And that is all for basic and advanced life support. Thank you for listening. Oh wait, sorry. Also, you should have a suture pack and an instrument pack as well. The emergency kit should also include the laryngoscope and the MBU bag. This is it for my advanced and basic life support for CPR. Thank you for listening.